Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Dr. Jeter isn't able to get online, so we'll have to try to get him to do it next week. This is an interesting article on why we have more fibroids in African American women, and it's a problem that is associated with a lot of pain and not malignancy, but a lot of pain and agony. Of course, in the long run, they often will have to have surgery, but there are also ways of dealing with fibroids that do not require surgery as well. And if they look at the reasons, some of them make sense, some of them don't. The hair relaxer one doesn't. What percentage of women you think use hair relaxer? Black women.
75%.
It's
I want
dropped.
a woman to answer that question.
I think it's dropped drastically the past few years. Most women have natural hair and don't use hair relaxers. Percentage wise, it's still a high percentage.
Maybe 40.
Yeah.
That's now, but when I was a young adult and etc., most Black women had relaxers. In fact, they frowned upon you if you still getting press and curl even today.
Right.
The relaxers cause burns. I had a Jerry curl and it took out my hair once. So then I didn't want to use relaxers whatsoever, but when they caused about burns and the chemicals that actually enter into it, I don't know how many now within the past 10, 15 years, now it's natural for younger women to have natural hair and even older women, but that has not always been the case, especially in the 20th century. And most of us know that. And if I don't know how many women on here have had relaxers, but I know I had fibroids and I was wondering why Black women, my aunts and everybody had in their 30s, 40s, we all had fibroids. And the first thing the doctor wants to do is do a hysterectomy. So that was
that's not the first thing the doctor wants to do.
Well, I didn't have what other choice did we have? They didn't tell me anything else. Well,
of course, no surgery is an option and taking care of the pain. The other one is they have a medication they can insert through blood vessels that treat fibroids. They may not have had them 30 years ago. They have them now.
Oh, they got them now. When did they get that? Because this is
about 10 years ago, maybe.
Okay, the articles say that Black women have the rate of Black women having fibroids and hysterectomies is about 80% of Black women. And that is 2 to 3 times higher. Those rates are 2 to 3 times higher than other ethnic groups, particularly white women.
No argument there.
Yeah, but it's like the biggest cultural difference, like they say, stress can be a trigger, but it kind of stands out, the use of hair relaxers. This is anecdotally, but I know Black women who have never used hair relaxers through their life, and they didn't have fibroid tumors or hysterectomies.
And the subject of hair relaxers came up last week. We talked about people dyeing their hair, people with natural hair. And in my family, I'm that one who will use a relaxer. Not as often, it's very rare now, but most of my family members truly, almost all of them, natural hair products. And like I said, it's very much common. It's becoming more common now. And it could be some of us, sitting here today at one time may have used a relaxer, but nowadays the natural look is what most women go for, but it's a personal thing.
On this, how many women have had hysterectomies?
I have.
Well,
I have.
Are we doing that? 80% of Black women having hysterectomies, is that represented on this call?
Probably, but I didn't have fibroids.
And I did not either.
I did.
I have not had either fibroids nor the hysterectomy.
I
did. Neither have I.
I have not had fibroids or hysterectomy, and I do use the relaxer and have been I'm 77 and I have been using relaxers in my hair since I was in my 20s.
Interesting.
I'm too old school now to change.
Well, it's interesting. There's no data here about the causation factors.
Right.
And so this is all
Anecdotal.
anecdotal. And so it's quite interesting to see what really is the cause. We still don't know. All of these things may be causative,
But let me just add anecdotally too, though, that because of some of the problems that accompany or that are precursors to the hysterectomies aren't the worst thing that could happen to you.
Not at all.
It was a welcome godsend for me.
Well, hysterectomies have a lot of downstream collateral damage.
Nope.
Because there's not only just the surgery, but in a lot of cases it does lower sex drive, and collateral damage that it has on marriages as a consequence to that. So it has effect on the Black male population too.
Well, I think that a lot of that is myth and just not real. I think that at least of all my friends that have had hysterectomies, it had quite the opposite effect on sex drive. I think that's a lot of made up stuff.
And I agree with you. I do agree with you.
I also agree with that.
I was directing a choir and I was mentioning to a couple of ladies that I was getting a hysterectomy, and their first response was, "Oh, now you can swing from the chandelier."
Exactly.
Yeah.
Let's go to the next one.
A little bit off topic, Doc. Before we move, when I was in my 20s, I had a lot of hair, and I used a relaxer, and it burned my scalp too. And I think that's probably the cause of my hair condition today. It burned my scalp for real.
Right.
Now, that's interesting. This article is 1 in 5,000 chances of a breakthrough infection. And as we encounter more and more people.
I guess I'm okay right now.
Really, you need to mute.
I got her.
Okay.
Yeah, so it's interesting because we read about the breakthrough cases. We sometimes think that they're very common, but 1 in 5,000 is about what it seems to be, although it could be actually less than that. But because when you talk about the hundreds of millions of people who've been vaccinated, and we talk about the people who've had breakthrough infections, we number them in the thousands. So this is, and sometimes when you read about those breakthrough infections, you forget about the numerator, the top part, and think more about the denominator. But so I guess you have to take that into consideration as you read about the breakthrough infections that are occurring. And this also brings to mind whether the Delta issue has made it more of an issue than was before, and because of the increased transmission of COVID because of Delta, that does make it even more of a concern.
Dr. Callender, does anyone know about why there is so much, besides our political views, why media, why is there such a pushback on this vaccination? They'll cite the one person that got it for a breakthrough, and then the media just go frenzy like everybody's getting a breakthrough. Anything's happened, they just seem to exploit it. What's going on in our society that they got to really perpetuate not getting a vaccination?
It sells papers. It's economic. It sells papers. The story is a story. But I think you're looking at it from a realistic perspective, that it's taken out of context. But then that's what journalism often does. It emphasizes those things that stand out, which aren't necessarily very common, but it's something that people need to know about. So I think that's what it is. But you're correct in recognizing that it is a disincentive to some people to get vaccinated.
So that means our last president, he was right in fake news.
Well, I thought he was the master of fake news, but anyway.
Okay.
And this is what puts things into perspective. That unvaccinated 11 times more likely to die of COVID than people who are vaccinated, which is something that is more important to publicize, but is less likely to be publicized. And this is, you would think this would be something that you want to be told, so that more people who are reluctant to get vaccinated. But and you do see it. It's buried in a lot of the stories, just not as highlighted as I think it should be. Any other comments on this article? Because it's of course, we still have an issue with many of the hospital staff still not being vaccinated, still having about 30 to 50% of some staffs are not vaccinated, while 95% of the physicians are vaccinated. Now, see, this is the kind of article you're talking about. 14,000, over 14,000 have been hospitalized or died. Might make you think that breakthrough hospitalizations and deaths are very common. Any comment on this? Any thoughts on this? This is, I think the data speaks for itself. It's interesting because most of the older people are vaccinated, and it's the younger people who are more often affected by the Delta variant.
Dr. Callender, is there any information, any data available on these breakthrough cases, whether individuals had pre-existing conditions?
There is some data, but I don't think is enough to really talk about yet. Haven't seen data that actually breaks it down so that you can actually make a comment about it. Because most of the people with pre-existing conditions we're in that group, but they haven't characterized it fully enough yet to make a statement about it. But that's an important question to answer.
Or even with particular kinds of pre-existing conditions. That would be interesting to know as well.
Yes. This is an article that characterizes what many of the breakthrough cases have had. And what was always interesting about it was that the fatigue was the issue that often came first, and then the headache and other things, and then the taste issue. And I guess it's kind of frightening when you know you've already been vaccinated. And then people start wondering, well, what did I do? Did I take my pain medicine too soon? Or what did I do to modify the vaccination? And when in point of fact, it has nothing to do with that. But we always look for something to blame. The issue is that you would like this to stimulate the unvaccinated to get vaccinated. That would be the desirable consequence of articles like this. Glad we can welcome back Flavia, who's been away for a while, had untimely death in her family, and we're happy that you're back. Flavia.
Well, thank you. It's good to be back. I missed everybody.
We missed you very much. It's interesting how we still have a significant number of people who are not going to be vaccinated for a number of different reasons. And while we talk about reasons for the reluctance, for many, it's a badge of courage. They're going against the grain.
Dr. Callender, I've heard several people say literally that they're not going to get it because they're covered.
Covered?
Covered by the blood of Jesus.
Oh, really?
Yeah, that's what they told me.
Hmm.
Three of them. Three of my
Three people. Wow. Have you had that commonly as a reason, Carol? Have you heard it too? John?
Yeah, I've heard that. I've heard that.
All the time.
Yeah.
Right.
Where do you think they get that from?
Their faith. Yes.
Yeah, but you know that story that they tell all the time about the Lord sending rescues and we ignoring the rescue. He gave us this knowledge and information to help people. So all of the scientific knowledge we have, I mean, it comes from above, comes from God. So that may be the blood that they're talking about.
Let us pray.
But Dr. Keller, remember in the beginning, churches were staying open and ministers were dying and everything because they said if you didn't have faith, if you did have faith, you would still go, and etc. And soon that dissipated. But and still some churches and some people, they never did stop worshiping because they said anybody that didn't come, they blamed it. They said they didn't have faith.
Yeah,
and nobody wanted to say they didn't have faith in God So consequently, they kept going.
Yeah, and as you know, the death rate in churches was pretty high, and we had many ministers dying. So we have to balance that with some reality, although to live as Christ and to die as gain. But there are many ministers and many stories that relate that many of the sources of the communication of the transmission of the virus was through the churches themselves.
Dr. Callender.
Yes.
You know, many people read the Bible, but they don't learn the lessons. And I often relate the story of when the children of Israel were in Egypt, and God used Moses as his mouthpiece to tell the people what to do, to protect themselves from the plagues. And so we have to realize that God still works just like that. And so he has given his chosen medical professionals the word and what we should do to protect ourselves during this pandemic. And so people are just hard-headed, and they read and get out of the word of God what they want to get out of it. And some of it is just selfish.
I think a lot comes from these leaders that are telling the people that. They're like, they believe everything. Anything that's the opposite, they'll go ahead and believe, too much, I don't have any stress because I'm saved. So that means if you have stress, you're not saved. But anyway, we'll get on that topic.
I was at Reed Temple yesterday. My stepbrother passed away a couple of weeks ago. He was one of the ones that said he was never going to get a vaccination because he was covered, but he had blood clots in his legs, and I guess he felt he was covered. He didn't go to the doctor, and the blood clot broke off, and he died. Anyway, I was in Reed Temple, and I think the gentleman that spoke to us might have been there, but they had social distancing. Everybody had a mask. They had a scanner for your temperature. They had hand sanitizers all over the place. They said after the service, no socializing in the church, in the temple. You had to go outside to do that. So they are very much aware of the situation.
Amen.
Very supportive of the science as well.
The AME Church has a very aggressive COVID-19 protocol, and they've been doing really great in-depth trainings and that kind of thing, but they also have protocols in place for churches.
Well, you remember the minister there came to us and talked to us about how his family members died and how aware he was of the importance of COVID.
It was interesting. The funeral that I went to was my sister-in-law lived in Jackson, Mississippi, and of course, Mississippi is one of the cauldrons of COVID. And it was very, very interesting to see a lot of people who just on the street, just driving, were not wearing masks, or going in stores not wearing masks, but most of them did not look like us. Most of the people wearing masks did look like us, but the mortuary that was used, that were very strict protocols. It was literally a pass-through viewing, a visitation. You could not stop to talk to anybody or whatever.
Good morning.
Walk through social distancing, and the funeral directors were very, very conscientious about making sure that happened. And no funerals could be held in a church. They were all graveside. So, but the Black people seem to be more conscientious about observing things than other folks. But I kept moving around in the airport, because even in the airport, everybody did not have on a mask, including the airline personnel.
Really?
Or if they had them on, they were not wearing them properly. And I even asked one of the folks, I said, could you please put your mask up over your nose? And they looked at me real funny, but I kept moving around. I was like a little ant scattering around because more and more people came in because flights were delayed. And I just didn't want to be close to anybody. So I just kept moving, trying to get away people.
Well,
I don't blame you.
we had our first open service Sunday. And it was interesting to observe the many ways in which the protocols were broken. One of the ways was that because there was more people than they expected, the seating arrangements were not followed through appropriately. And then the leaving from the church was also poorly done because they wound up bunching up towards the door before you get outside. So there's a lot of little things that they really need to work on to really make it work. They meant well and they tried to do it right, but many breaches. Flavia, is your church open yet?
No, we're not opening. We had hoped to open next month, but after the variant came out, we decided we're not opening, and we don't have an open date yet. We're hoping after the new year, but it's all going to depend on data and science and realizing that our congregation is an older congregation, and too many people have pre-existing conditions. We'd rather be safe than sorry. So we're going to continue our virtual services until it's safe for people to gather.
Any other comment before we go into this booster issue? It's interesting to see many of the reasons why the booster shot plan is controversial. And I think the more you read about it, the more you understand the reason for the controversy. Because the controversy is only about whether or not the vaccine is effective against the Delta virus and whether or not everybody needs it. We know there are certain groups who need booster shots, like people who've been transplanted and those who are immunodeficient. But these articles are about whether all Americans need to be vaccinated and whether all Americans need a booster shot. And so that's where the discussion and the controversy exists. Not over whether special groups who are deficient need a booster, because they do, but over whether or not people who are already vaccinated need a booster shot at all. And the data is only crystal clear on those people who are immunodeficient, but it's not as clear on those people who are immunized. And we'll see some articles that discuss in greater detail why they think that the booster shots for some, for all, are not necessary. And it's interesting because you see conflicting statements made by different groups. The CDC may make a statement, the WHO may make a statement, the president may make a statement, Fauci may make a statement, and you have disagreements. And it's interesting that much of the data indicates that the vaccinations are very effective. Now, one of the arguments they also use is the fact that probably no more than 20% of the world is vaccinated, which means 80% is not vaccinated. So we need to So they're saying we need to put more emphasis on getting everybody vaccinated rather than on booster shots. So that kind of puts into perspective some of the booster controversy. Any comments or questions about it? This article goes into good detail about it and alleges that the efficacy of the vaccine is so good that even for the Delta variant, that unless you're in the deficient group, there isn't a great need for a booster shot for everyone. Now, they're talking about for everyone, not recognizing, not discussing the unique immunodeficient group, which everybody agrees needs a booster shot because they haven't gotten the antibody protection up to what normal people have with the first 2 shots. But this is a very good article that talks about the importance of not only antibodies, but also some mediated immunity. And the two together are what allow you to overcome the infection. And so if you got a good antibody titer and you have a good T cell balance, then they are feeling that the vaccine is efficacious enough to not require a booster.
The memory immune response is very interesting in that.
Right, because that's one of the things that we haven't been able to measure as well. Antibody titers are easy to measure, but the T cell mediated immunity is not easily measured because the memory cells are the T cells, and they're the cells that when the infection comes back are activated. And so what is the role of the FDA? Well, all they want to say is whether it's safe and effective, which they have argued well. The other question is whether it's necessary for everyone, and that's where much of the controversy is associated. Now, some argue that it's just a ploy for Pfizer and Moderna to make more money. They sure have made enough money already, but I think that is not the issue. I think the real issue is whether or not the data supports the need for all healthy people needing a booster. And so far, the data is still, the answer is still not there. Or the answer suggests that a booster shot is not necessary for everybody. Any questions about that? Of course, most of the data is based upon the Moderna and Pfizer. And there isn't a whole lot of data on the Johnson yet. So they're making no comments about that.
Dr. Callender, my feeling is that, with these conflicting opinions coming from scientists, that muddies the water so bad that, a lot of people are gonna, maybe have even a negative outlook on vaccines altogether. I mean, it could really have a bad effect.
Well, I don't know why it would have a bad effect, because basically they're not saying the vaccine, all they're saying is the vaccine is great and you don't need an additional shot. That's what they're saying. And you're right, though, some people may misinterpret it, But what they're saying is that the vaccine is very efficient and effective. And so you don't need a third shot. That's really what it's all about, whether or not you need a third shot or not. And most of the data is agreeing that the vaccine we already have is very efficient, and therefore you don't need an additional shot. So anybody who would misinterpret this to mean that you don't need a vaccine is getting the wrong read on this information, because the information is really only saying that the vaccine is very efficient and you don't need a booster shot for most people.
Dr. Callender, question. How is CDC and FDA classifying healthy people as opposed to people who need to get the booster?
They classify healthy people who don't have pre-existing conditions and people who respond to vaccines with a normal antibody production. That's what they're calling healthy people.
Thank you.
Now it's interesting, safely in DC, I saw some of the elementary kids going to school yesterday. And it's interesting because we know that it has been a detriment to students learning. The remote effort has been a detriment to, and we were already pretty low globally anyway. The United States has not fared well globally when we look at education. And so this was, the remote has set us back even further. So not to speak of the psychological and mental problems that it's caused, but at least that are associated with it. But anyway, schools are opening, and we think that it's beneficial. The question is, and I don't know what John Tatum has to say about it because he's the president of the union. But has that changed, John, in terms of the teacher's perspective?
By the way, I'm president of the retired teachers.
Right.
Okay. Not president of the real deal. What's happening is they're in negotiation with the superintendent of schools, and they have a memorandum of understanding, and they're trying to dot the I's and cross the T's about, who has to go back, who can stay at home. I have a daughter-in-law who has asthma, and so she would be a good candidate to not go back and just stay at home virtually. But that's a negotiation. For teacher had been vaccinated, we'll have to see what this memorandum of understanding says, because it seems as though teachers will have a choice of whether to go in or stay home, and that's what has to be negotiated.
Very interesting. It's interesting because in our faculty at Howard, the issue is similar because we have a number of faculty who are older and have pre-existing conditions, and they have to have that approved. And one faculty position is that it should be up to the faculty. But right now, the administration views it as a responsibility of the administration, and so does the certifying body. So that's the way it's being done at Howard. And each school is having to deal with it in its own special way, but there is a certifying body for all colleges and universities. And some of that has to be reckoned with. Any other thoughts about this very critical issue? Because the remote learning has option is something that has worked well for some people, but not very well for others.
Dr. Callender, it's a very complicated situation. A lot of these situations that force kids to be at home and not in school, that means some of the parents can't go to work because they have to stay at home and take care of the kids. So there's a big pressure to get kids back in the school, out of the home, so that the parents can go to work and make money. And they're getting rid of the rental, the rent support and the mortgage support from the government. At the same time that the virus is exploding all over again. My wife is back in going to elementary schools, and they've been open for about 3 weeks now. She's in charter schools, elementary schools, and a lot of the kids are not, keeping the mask over their noses. They have to take the mask off to eat. They're eating in the classroom, and one of the schools has sent the kids home. They had an outbreak, and so it's very complicated. It's not a simple situation at all.
Okay. Any other comment on it?
Yes, my granddaughter went to school, and somebody in her class tested positive for the coronavirus. So that whole class has to stay home in quarantine. And so we can't even go over and visit them.
Yeah. Well, that attests to the complexity of the situation. Nothing simple anymore, is it?
Nope.
Well, what is interesting that through it all, the shootings and trauma cases seem to continue to rise. And the kids make up a quarter of the new COVID-19 cases in the United States. So it becomes even more complex all the time. And you talk about the kids not wearing the masks properly. The adults don't wear them properly. So you can imagine how the kids will wear it, because they follow their role models, parents. So. Is that August 16th of 2021?
This article?
Well, no, it says since August 16th. Does it mean 2021?
Yes.
Yeah, of course it doesn't say that. It should say that. There's a lot of people who've died since that. Oh, that's right. They don't use masks. So, yeah. And the data on masks is unequivocal. It's interesting how different states handle it, and how they're allowed to handle it. And geography makes an important contribution, as always. Because if you live in Florida or Texas, you kind of are a victim.
Going back up where they said they don't allow the children to go outside to play.
Yeah.
Aren't they safer when they go outside to play than when they stay in that
Yes.
small classroom?
Yes.
It reminds me of 9/11 when I was teaching at the Southeast School in DC. And it was one of the old buildings. And our principal sort of got excited. So what she did, she told everybody that if something like that had happened again, we would seal ourselves up in the building, not let the parents in or anything like that, because they were thinking of that. And I was just thinking, we're sealing ourselves up into a tomb to die. But she was just going, and everybody was saying, yeah. And I'm saying, this woman, has she flipped? But she sent the physical ed teacher to get this tape and everything, how we were going to seal up in this porous old building and not allow the parents to get the kids and everything. She just went henny penny all over the place. But when they make these stupid rules for the kids can't even go outside to play where they're safer than in their classroom, somebody is not thinking.
Yeah. Yeah.
You know, so sometimes the outside situation where kids go out to play is not the ideal. You know, sometimes inner city kids, they don't have that much room to play outside. So I don't know about the way it is in Oregon, but I don't know what that person could be thinking. You know, it's much safer outside than it is inside. You know,
Yeah.
that seems illogical.
Well, there was only one school that I was at. They couldn't allow the elementary kids out because of so much shooting and violence around the school. And I didn't realize that until after I was there. It was 3 schools, and I can't name it because we're being recorded. But John also worked there. But the elementary segment, the children couldn't go outside for recess because of the violence in that area. So that does happen in the inner city, but that was before COVID and everything. But the neighborhood, because one time they discovered a dead body in the well of the middle school, junior high that I was working at, and everybody was just nonchalant about it. Oh, this happens all the time. So then I realized I was in a war zone.
Wow. Yeah, now this is something that is not only for schools, but everywhere. You go to every grocery store you go to, they're looking for people to work. And that's why it's interesting that people can't find jobs, but people are begging people to come in and work. I've never seen this before, where people just begging. Yeah.
Yeah, did you hear about the nurses? There were 6 nurses or something in Neil ward, and they quit, and they had to shut down. Their women couldn't deliver their children there anymore because they didn't have enough on staff to help them. And I was just wondering, what about those nurses? That means they don't get paid or anything. I don't understand it.
Yeah. Now, what is it you didn't understand?
Why they would quit their job because they didn't want to get vaccinated.
Upstate New York.
Well, they would have to, because I guess either you quit or you get fired, because they require that now at some locations.
So when you quit these jobs, do you still get paid?
No.
Do you get unemployment?
I don't know about
Not
that.
if you quit.
I don't know the answer to that.
So that means people,
if you get fired, you could.
Yeah, but how do they get money to live? I don't understand it.
You don't understand why they would quit?
Like, I needed money to work. That's why I
Right.
worked, because I needed money.
Right.
And I would think 2 times before, 50 times before I quit, where I'm going to get money from so we could eat. I don't know.
I'm not equipped to answer that question either.
Darryl, I bet if we looked at the people who were quitting, most of them do not look like us. So many of them may not need to work like we do.
Oh, okay.
And also, Carol, their age may play a role too, because if they're a certain age, they may be able to draw their unemployment or retirement benefits.
The other thing too, a lot of nurses are married to doctors.
Oh, John!
John.
And they won.
Oh, man.
They don't have to work.
Yeah.
Yeah, but they want to work, most of them do. They have a profession of their own that they want to practice. Yeah.
But remember, wanting to and having to are on different planes.
That's right.
Very.
Yeah. Well, so Tennessee is a new leader in COVID cases per capita, huh? A distinction that I'm not sure anybody wants to have, but the South has been at the top of the list for quite a while.
Red states.
Yep, yep. Well, you wonder how long this will be, because this is the second year, and we haven't learned yet.
Well, as long as they keep passing the voter restrictions, may have to look at it a little differently. We look at who's dying.
Yeah.
I'm going to have to jump off in a minute. I apologize, but if I may, I'd just like to share something that I think is important. This is unintended consequences of COVID. I just feel like anything that happens health-wise, we have a responsibility as African Americans to share it if it can be of some help to someone else. My sister-in-law did not have COVID, but she was an unintended consequence of COVID. She was diabetic. We'd started noticing some cognitive decline. She lived alone. She'd become very isolated. And all of these things are not uncommon in our community. And her cause of death was a diabetic coma. And they were not able to bring her back. This is happening more than we realize. And I would just encourage everyone to stay connected to people that you know who have problems like, or diseases like diabetes or other kinds of really serious health conditions, especially now during COVID, because we are all isolated to some extent. And the stress of the isolation is also really facilitating more cognitive decline. So I just wanted to bring that up, because it is becoming an even greater problem as the virus lingers. So thank you for the opportunity to share that.
Thank you for sharing. Thank you for sharing. Because the data is clear that this is affecting our Black and brown population more than it's affecting the other populations. And so mental health issues, and some would call it collateral damage, but it's not collateral. It's really just damage.
It's good to see everybody. Sorry I have to jump off.
Okay, great to see you again.
See you next week. Hopefully.
I have to jump myself. I'm going to a funeral, so.
Okay.
Is that Betty?
Yes.
I want to add too, we all try to be vigilant in encouraging friends, family to get vaccinated. My son, who runs his mouth about everything, didn't want to say, but he said to announce to the group, he's gone to get his vaccine. He's been vaccinated.
Wow. Very cool.
I don't know whether it was my questioning or his trip,
I don't know either.
or his trip coming up.
Doesn't matter. Doesn't matter.
Or his trip coming up.
Yeah, that Puerto Rico trip. Well, doesn't matter.
It doesn't. It definitely doesn't. But that's good news.
If
That's
he's
good.
gonna
Yes, it
travel,
is.
he has to be
Yes.
vaccinated. That's right. Very
Mhm.
good.
Yeah.
Awesome. Praise
Yeah.
God.
Yeah.
I'll see everybody next week as well. I have a
Yeah.
vote to
Yeah.
go.
My bad.
Now we have to get your grandson ready.
Yes, I wish he had heard that. Matter of
Yeah.
fact, I'll play the recording back for him.
How old is your grandson?
He's 25, he'll be 26 in December.
Okay.
Yes.
Yeah, he's right in that ballpark.
Yeah, yes, he is. Yeah. And
Great
It's-
news.
he keeps saying all this time through the main beginning of it and all this time, he hadn't caught it. He first stopped going out, but then he started going out, and he says, I haven't gotten it and I'm cautious. I wear my mask.
Mhm.
So we're vaccinated, so.
Well, this is an article about something that is happening more and more. I went to a concert last week for the first time, and also went to the movies. So that things are opening up. The concert, I was a little surprised. It was a Johnny Mathis concert,
Mhm.
and you were required to bring your medical record to demonstrate that you were vaccinated. If you did not have that proof of vaccination or a negative test within the last week, then they would refund your money.
Mm.
But what was interesting was that there weren't any. Everybody had to wear masks, and there was no exceptions. And much of the audience, I'd say about half of the audience, was probably over 60, at least. But there were no special precautions, like you see some have screens or something, but it was nothing like that. And the seating arrangement was nothing special. So that it's clear that crowds are coming back amid COVID with often no requirements other than that perhaps that you are vaccinated and you have a negative test.
Dr. Callender, I went to the Washington football team game on Sunday, and it was packed, and there was no mask requirement unless you were inside like the restroom or a store or something like that. Most people, I'd say, did not have the mask on. It felt like you were outside. But I mean, if you've ever been in FedEx Field, the seats are they feel like this. I mean, they're so close together. I mean, it's, I was very uncomfortable there. And we ended up, leaving our seats and going to one of those areas where you could just stand and see the big screen. I mean, we might as well have been at home watching it on TV. But they do have open spaces, where you can stand around outside, But even in the open spaces, my wife and I, Lauren went to the game. She kept her mask on, at least one mask on the whole time. But so far so good though.
Dr. Callender,
Dr. Callender, this is
somehow,
Dolores. Hi, John. We went to the Mystics game last Friday at the DC Sports Complex Arena, and you had to wear your mask. If you had floor seats, you had to show that you were vaccinated. They put a special band on you, and they had you sit where you were social distancing. So since my daughter works for the Mystics, she said, well, where do you want to sit? I said, I want to sit where I can see, but I don't want to sit around a lot of people. But the seats were wonderful, but you could social distance. If you were eating, you could not. They didn't want you eating in your seat without your mask. So most people stayed outside. I said, we'll see how long this is going to last. But it was very interesting.
That sounds great. Interesting. Yeah. I wonder how it's going to be at the at the Verizon Center or whatever it is now. Yeah, that's interesting.
Dr. Callender, somehow I knew that Johnny Mathis was one of your role models based on how you sang last week.
That's an interesting comment.
Johnny Mathis.
That's my man. Yeah, he still has his voice. It's amazing. At 86, he still, well, September 3rd, he'll be 86. He still has the great voice. Still. Amazing.
Where was the concert?
It was at Strathmore
Oh, okay.
in DC. Yeah.
Okay, I have a question for John Buchanan. In the beginning of this COVID, you were precautious and your wife was extremely precautious. And you know how you sanitize your groceries and everything. And if you went out, you couldn't come home for 2 weeks. So when did all of this change? How did you get, how did she become more relaxed? And I noticed you were saying she's back to teaching. There's still some teachers that don't want to teach and etc. How was she able to lower the bar?
Well, when she got her vaccine, really.
Okay.
Yeah, when she got vaccinated, she felt better. And now she says her vaccine is better than mine. She got Moderna. So she really thinks that she's got the upper, what do we call it? The upper arm. Anyway, but she still keeps her mask on. Even when she goes outside, she keeps her mask on. So she's still very, very cautious.
Oh, okay. Thank you.
Mm-hmm.
Yeah, that's interesting. Yeah. Okay. So it's going to be interesting over the next 3 months to see how athletic events and concerts, which are now becoming common, will be affected by all of this. And I think, just as you mentioned for the Mystics game, that they're going to require proof of vaccination at many of these events. What's going on in Chicago, Darryl? What happens there? Anything special? Darryl? I guess he can't hear me. Okay. Well, anyway, it's going to be interesting to see what happens this fall. Of course, the other thing is that we remember the article of last week that talked about that's not the only vaccination you need. So remember, the flu vaccine is it's starting now. Although I'm going to get mine in October, but the time for the flu vaccine starts this month.
Dr. Callender, take a look at this photograph. 50 people there, one person has the mask on, one. And they're not socially distanced.
No, where's the mask? Oh, on the left, yeah, right, one person. You're right, one person.
This person has a something on, but it's below.
Yeah, it's not in, but the nose is open. So I mean, what good is it? You're right. It's oh, requiring proof of a negative COVID test within 72 hours. Okay, well, that's something. Now look at this. The announced crowd was 100. The real number was maybe 95,000. Wow, that's a whole lot of stuff. And as we all see, they're stacked on top of each other. Yeah, it's just like you mentioned, Buchanan.
Yeah, there is no social distancing at a football game. And
that as a matter of fact, that isn't even close. That's yeah.
Dr. Callender, the test for COVID, how is that done?
They have, I don't know which test they use, but I know most of them you can get a result in in 4 hours, some of them. So
What do they do? Swab your nose or
yeah,
what?
yeah, they still swab your nose. And for example, we have to do that every week at Howard.
Mm.
And the swabbing of the nose is nothing like it used to be. Remember, they used to go all the way deep down in your nose.
Mm.
Now they just do it very superficially, and it's not uncomfortable at all. But and the result is back within an hour or two. So now, as we mentioned last week, they have those kits that you take home, but they only let you get 4 per person. But so you can do home testing.
Someone was telling me the rapid tests and all these tests cost you money. It used to be free. So
The tests are free, but if you want to do it yourself, it's cost you money.
so the rapid test, is that free or not?
Yeah, you have
It depends.
To buy. Yeah, you have to.
If you get it done at a place that does them, then that's free. But if you want to buy it to do it yourself at home, that'll cost you. I don't know the cost, but I saw a gentleman taking 4 of them at a time. Well, that's all they let you buy.
Dr. Callender, I have bought, I don't know if you can see this box, but from
Yeah.
CVS, this is the rapid test. Costs about $24, Carol.
How much?
About $24.
Wow. Wow. And it goes like they buy them and sell out rapidly.
I'm sorry,
You
what
get them
was
at
it?
CVS.
Yeah, got this at CVS.
Yeah.
So that means, where can you get it for free?
You can't get it for free. If you want to get a test done and you go to a center that's doing it, then you can get it done for free.
Yeah.
I know Kaiser has them. Their rapid test comes back in 24 hours.
Is that free?
Yeah, it's covered. It's covered by Kaiser. You know, I have Kaiser insurance.
Oh, you got Kaiser?
Yes.
Which
Oh,
means it's not free.
okay.
Yeah, it's interesting, this anti-government position. Anything, it reminds me of what Chris said last week as the reason he didn't want to do it, because the government required it. And as was mentioned before, you have a lot of people who are negative and say they won't do it because it's forced on them.
Well, everything's been forced on you, whether you get a driver's license or whatever you get. It's forced on you. So I don't understand the logic to this.
I don't either.
Vaccination that we had to get, and even when I was working, children had to get vaccinated or they got kicked out of school. So
That's
all
right.
of this, you
Right.
can't do anything without getting a license. You can't even have a dog without a license. All these things are mandated. This world is just, the way they're doing things and everything, making people think that they got a choice. It's like we don't have a choice about too much.
Well, it's interesting that there are people who feel strongly that they have a choice. And so this is one of the areas in which they take advantage of it. It's unfortunate that it's hurting other people. That's the part of it. And that's where the problem lies, is that they're not vaccinating. Being vaccinated exposes them to a risk, but exposes others to greater risk. And that's the aspect of it that is bothersome. If it only affected one person, that'd be okay. But it affects many others.
Just like with civil rights, and they gave children rights. Everybody got rights, but they don't, it's just, they take everything to the extreme, and then they take freedom to the extreme. So.
Well, of course, we have more freedom than most places have. So
we have
sometimes
freedom.
we don't appreciate it until we go to other places. That's why I think it should be required for all people to go outside the United States so they can see how it is in other countries and appreciate what they have.
Which country you suggest?
Nigeria is a good Africa's a good place, you know.
Okay.
Dr. Callender, this is another perspective. This guy owns a restaurant in Idaho, and he's saying that, you know, his place is open. They don't have any restrictions or anything like that. He said not a single person who worked for him got COVID, and nobody in his restaurant has COVID, but yet the hospitals are packed. They can't even take any more people because they're packed with COVID people.
Right.
So, yeah. They're not in this restaurant, they're in the hospital or at the
right. Yeah, but that's what anecdotal thinking will do for you. Man. Yeah, wow. Wow. Yeah, this is interesting how the Aryan, of course, you know what Aryan means, so it speaks for itself. Can you imagine this armed groups patrol to protect against non-existent Black Lives Matter protesters? Can you imagine that? Boy, what a place, huh? Wow. It's hard, it's almost hard to believe that places like this still exist, but they do. White supremacist, anti-Semitic. Do you see the comment? I don't think that they are, go back to that. I don't think majority is hateful. This is more about constitutional rights. And they actually believe that. As hateful as they are. The Aryan nation, which speaks for itself. Constitutional rights. Now this, I thought is interesting to look at the way some people look at mandatory vaccinations. Here you see that police unions were opposed to it. And it's interesting to see what the legal action will result from. Darryl, you aware of any of this?
Yeah, just you know, no more than what this article says is the information we've been getting in Chicago, like Chicago Tribune.
Yeah, so they are. I was reading somewhere that someplace, some of the I forgot what city it was, all of the police resigned because they refused to be vaccinated.
Mm.
Well, the connection is most of Chicago police force is white, and they're very much right wing aligned. And so, you know, the right wing, what they get in social media says be anti-vaccine mandates.
Mm. Oh.
So that's not necessarily anti-vaccine, but anti-vaccine mandates. They're against being mandated to have to do something.
Well, in Chicago, there's okay, like a badge of honor, being right wing is anti everything, anti-vaccine, anti-mandate.
Look at this, LAPD, 85% of infected members were unvaccinated. Yeah, which is generally what it's like, but.
Yeah, I think our police forces are just another branch of the KKK.
Wow, that's saying a lot.
Mm.
Wow. And the deaths continue to rise. Well, here we go again. Of course, a mandate for all federal workers is saying a lot.
I think the mandate also is for the federal contractors.
Right.
Yeah, which is interesting. It's interesting that they make such a huge thing out of vaccination, especially when it becomes mandatory. There's probably not much discussion about it occurring in hospitals, but when it affects the police, because people don't realize that police interact with people so commonly. This is an article that talks about the efficiency of the Moderna vaccine and about the immune responses that last even longer, fostering a lack of need for healthy people requiring a booster shot. How many of you had the Moderna vaccine?
I had Moderna.
I have also.
You had both. Okay.
I've had Moderna.
Yeah. Yeah. That's the one that seems to be the one that's undergoing most of the long-term tests. Although they both started around the same time. And there was some debate over which was better, the natural or the vaccine. And the common conclusion was that it's optimal to have both, to have the natural infection and also get vaccinated, which is the most powerful.
So is that saying you do yourself a favor if you're fully vaccinated and then have a breakthrough infection? That if you survive your breakthrough, your immunity will be the all-time best.
Well, actually, the implication was that if you see beforehand, many people, we didn't have a vaccine. So if you got the infection before, and then after that you got vaccinated, then the antibody responses were great. The situation that you suggest is not recommended, but if it happens to you, you are okay. But that was not recommended, that you get a breakthrough infection. So, but if you do and survive, it optimizes your antibody response. But this article kind of emphasizes the point that while we look for antibody responses, the T cells, which are the memory cells, are really one of the ways in which your body responds that you may not even be able to identify. So they're saying in many ways the antibody is not the only answer to it, but it's a combination of antibody and T cells together. And they say robust based upon the tests of the Moderna vaccine. And they're also saying that they're not sure whether this is true for all vaccines, but because they've only tested the Moderna. So, but those that have tested both have concluded that the efficacy, as we talked about in one of the earlier articles, was about 80%. So I guess the conclusion is that the vaccine is very effective, and that we are fortunate to have
No,
had.
I'm on the physician's call. Okay, I'll call you back.
Mark's good to see you.
Hey, Mark.
Yeah, I had the PG County had a day off today for Yom Kippur, so decided to join the group. Thanks for having me.
Yeah, yeah. One of these days you have to tell us your story. We've heard a lot of people's stories. We rarely heard your story.
I have plenty of stories. Which which story? The parenting. We're talking about donation. Which one did you
Donation. Donation.
Okay.
Nottingham's.
That too. Yeah.
He's a great musician as well. So, but the donor story is a story that we've not ever heard about. You've done something so gallant, and yet you never ever talk about it.
Amen.
So I have 4 minutes because I don't know when the next Thursday I'll be available. That I can summarize in the next 4 minutes.
Go ahead.
So, my dad, John Tatum Jr., was needing a kidney transplant, and essentially, so this was around 2006, 2007, and I, just empathetically, I grown tired of seeing him go to the dialysis center, and he was on his, he had a faithful schedule and everything, and I just thought, man, how that must, I couldn't imagine having to do that. But he was doing it faithfully and having to do it faithfully, and testing for matches, and nobody seemed to come up. So I don't really know what, but I said, okay, you know what, you can test me. Let's see if I'm a good match. Because if anything, I wanted to try to alleviate as much of the rigor that he has to go through as I could. So they tested me, found out that I was a good match for my dad. So I was like, okay, you know what, let's do it. So we, went under the knife and was able to successfully transfer my one kidney to him. But several days later, just shy of a week, so he started developing complications from the transplant, which is to be expected. But the doctors, they said out of the abundance of caution, they took the new kidney out because they didn't want any more. They didn't want him to experience any more severe reactions to it. And so they took it out, and lo and behold, he had to go back on dialysis, for a while until he can get a new kidney. So I was very miffed about that. But I understand, and they came and explained to me after the fact, why they had to do that and why they made the decision. Logically understood, but just emotionally, and health wise, I was like, so what was all that I went through for? But the better news is that they originally found another kidney for him, which is currently working. So at least he's not suffering in that capacity anymore. And I was just happy to be able to at least try to help in that way. So
how did that affect you when they took that kidney out after you had given it to him? What was the psychological and emotional impact upon you as a person having done so valiantly and gallantly, and then you see that they had to take the kidney out again? How did that affect you, and how long did it affect you?
Great question. Yeah, emotionally, psychologically, it affected. I have a good anchor. I have a good support system in my family, and my faith. Well, my faith is the thing that that really keeps me buoyant. To not be down and depressed for very long. But I mean, but it did have an effect. You know, I was like I said, I was pretty perturbed that it didn't work out. Um, and again, I logically understood why, so I just kind of talked myself through it, talked to my community about it, and again, you know, just relied on my faith in God to be able to support me emotionally. So, so and physically I was okay, and physically what it's done for me is just caused me to just make sure that I'm maintaining my health at tip top condition. Um, you know, so but yeah, psychologically, emotionally, it did have an effect. But thankfully, I had some human resources and spiritual resources to rely on to kind of bring me back to being okay.
Very interesting story because we often talk about people who donate, and we don't almost never hear about the person who's donated, and then the kidney is rejected. And we rarely hear what impact is that upon the person who donated the kidney. Uh, how much despair and despondency and depression does it cause? And so the fact that you could share that with us is spectacular. And I
mean,
appreciate
yeah,
it very much.
yeah. Again, the main things for me were just like I said, the community support, the spiritual support. I think that's the thing that really kept me more than anything. I mean, because yeah, those feelings of regret or remorse or what have you, that those are real. I can attest to experiencing those, but thankfully they didn't last long, and they didn't take me under because of the support that I have and that I receive. So, but yeah, I can certainly attest to that being a reality for live donors. That is a thing.
Dr. Callender, if I can add, it was his faith and et cetera. I was completely, as you know, I was devastated. But the family, we rallied together in the prayer. And then once, I don't know if Mark remembers, we were outside as a family unit playing volleyball. And Mark said, I can beat all of y'all with one kidney. And he just made light and jovial about it. We're going, say what? He said, one hand behind my back, I can beat all of y'all. And we up there trying to scramble. But his faith and just how, he reacted, it kept the rest of the family uplifted because personally, my son, losing that. And he did ask the question, well, what did they do with my kidney once they removed it from my father? And I did not have the heart to say, and I don't know, Mark, how you found out, to say that they just threw it away. They couldn't use it again. That was the trauma about it all,
That's where I felt a little bit strong feelings, because I said, well, they couldn't put it back in Mark and they couldn't put it in somebody else. So they just had to throw it in the trash, and that was devastating to me even.
Yeah. So, and then it was a family agreement. His wife and everybody had to agree, that this could take place, because he wouldn't have done it unless his wife and everybody was on one accord, and the prayers and everything. So it had to be a family, and he had to have support, the whole family.
Mark, have you had any physical ramifications of not having both kidneys?
Another good question. Slightly, not anything majorly. When it first occurred, what was interesting to me is that my body it felt a loss. Like it felt like my body was mourning an internal loss. I can't explain it better than that. It's like my body knew something was missing and it was gone. And I took the full measure of recovery that they say 6 to 8 weeks and that sort of thing. And but months after that, years after that, like I'm okay. There's no residual effect. Again, I do my best, with a better diet and good exercise to, make sure that I'm doing okay. But I could tell that initially I could tell that, my body has changed, and my wife said she's seen my body, and she's mindful of it. Like she knows that there's something missing, and she could say like when she looks at my abdomen, she kind of remembers each time, and she feels like something is missing. I haven't noticed that about myself, but she's noticed it as a outside observer. So, but physically I feel fine. Again, I try to do the right thing, so there's no lasting effects, but initially there were some major effects.
Yeah. Did anybody wonder why we can't use the kidney after?
Yeah, I did.
Well, the reason is because the antibodies from the recipient actually destroy the kidney, so that it couldn't be used. The kidney turns black and blue, and it's a nice pink kidney when you get it, but after the antibodies and all those other things jump all over that kidney, it turns black and blue, and it's not any good anymore.
Not usable anymore. That's interesting.
Right. As a matter of fact, it's harmful if it stays in, so we have to take it out. So the best thing we can do when it becomes toxic like that is to take it out, so it doesn't do any harm to the person who has received the kidney.
Dr. Callender, I've always wondered in John Jr.'s case, why he became diabetic after having the transplant and then recovered from the diabetic condition.
Because of steroids. Steroids produces diabetes. And so when you get transplanted, you get a lot of steroids, and steroids is diabetogenic.
Mark,
Yes.
I would just like to say to you that you are truly remarkable.
I like that.
I'm
remarkable.
I appreciate that. I can only attribute that to the golden rule. I wouldn't want somebody to do that for me, so I'm just doing it for others.
Great role model, isn't he?
Yes, indeed.
Yeah. Well, thanks for that, Mark. I always, many donors talk, but we rarely ever heard from a donor whose kidney was lost after he donated it. So thanks again.
No worries. Thanks for having me, guys.
Okay. All right.
If you don't mind, I like to back up to something very briefly. The first topic we talked about was hysterectomies, and I had the wrong target. The target should have been ovary removal that I was referring to. Hysterectomies, if you have problems that require hysterectomy, there's a lot of benefits associated with it, and it doesn't necessarily decrease sex drive. In a lot of cases, it will increase sex drive. A lot of times, women are offered elective ovary removals, oophorectomies, and there are a lot of downsides with ovary removal, such as been linked to cognitive impairment caused by estrogen deficiency, osteoporosis, increases likelihood of hip fracture, sexual dysfunction, decreased sexual function, and hypoactive sexual desire disorder, hypoactive lessening, and quality of life issues that can lead to dissatisfied relationships, low self-esteem, so on. And so if it's elective, that's something that should be given some really serious hard choices, unless you're extreme ovarian cancer risks. It's probably a good idea to decline having the ovary removal.
Yeah, there have to be specific indications to got your ovaries, right? One of the reasons why some people do it is because they have ovarian torsion of the ovarian, and as a consequence, it becomes painful and also loses circulation, and so it dies. And so, but that's taking out one ovary. Taking out both ovaries is another story, right? Because that has all the consequences that Darryl talked about.
Dr. Callender, have you heard of Professor Dolores Cahill?
No.
She's running a movement that is against taking the COVID. She's being removed from her job too, by the way. And she says that wearing masks deprive kids of their oxygen and therefore causes them to have cognitive decline. So I want you all to look her up, Dolores Cahill.
Why? Why would I want to look her up?
So you can share all the crazy stuff she's saying.
I listen. I like to deal with positive stuff. Thank you anyway.
Okay.
Thank you. By the way, I had made a comment about reviewing some of the episodes. We have, what is it, about 20 now, Darryl?
I don't know. It's a big number.
Yeah. And I thought it might be interesting. And I think Joyce sent us, it was Janice who sent us, and maybe Joyce too, sent us some of her favorites. And so I thought it'd be nice to look at them and identify perhaps top 10. You know, I sent out our app, and so when I get responses, I want to let them know that in addition to what we've already sent out, we also have an archives. And in the archives, I wanted to address those programs that we thought were the most helpful and the most desirable to accentuate. So that's why I made that comment. And so if any of you had an opportunity to review those and would get back to me in terms of what you thought were the most outstanding ones, that would be nice. And so when I get some responses from the app that I sent out, I can add that to the list of reasons why the app is beneficial. Or just some thoughts if you have any desire to do that. I'd appreciate it.
Yeah, Dr. Callender, one of my favorite was the doctor, the liver doctor, hepatologist who came on. I thought that was outstanding presentation.
Dr. Johnson, Lynn Johnson.
Yeah, he had that PowerPoint presentation.
Yes.
I liked that one. So put that in the list.
Okay. All right.
As far as a YouTube link, I can create a playlist called Top Sessions, and ones like from the liver doctor, Dr. Johnson, I can put that in the Top Sessions playlist.
That's it. That's a nice, I like that concept. That's interesting. Very good.
But give me your favorites and I'll put them in that playlist.
Okay. Dr. Lynn Johnson.
Yeah, great idea. And was it, Janice, you sent me, was it 5 or 6?
Yeah, I think 7 or 8.
Yeah, okay. All right. Yeah. So I'll share.
8.
Wow.
Okay.
Oh, right before we go, Pearline, she's not paying attention, but I'll call her. She was asking me, and I forgot to tell her about Constance Richardson, Dr. Richardson.